And we've got a gentleman that got on the call today to share his story. I was looking at our Facebook member community and I saw him post his testimonial. I've known this guy literally for 19 years. And so I reached out to him. I said, buddy, Mike, would you mind just getting on our call and just sharing your story, sharing your member experience? This was his post on our Facebook community. And I saw this. And first I was like, Mike, are you okay? Right. But I read his post and, just, wanted to have him share his experience as an Impact member. And Mike, thanks for being on the call today. I'd love to have you share, buddy.
Great. Thank you, Jeff. Thanks a lot. Listen, as Jeff said, I'm just going to talk briefly about my experience. And I talk on the Facebook post that, we all think that impact is good, but until we have a personal experience with it, we then realize how great a service we have with impact. I was really one of the 40 million people that was playing Russian roulette with healthcare because I always thought that I was pretty healthy. And so I just didn't deal with health insurance. And then when I had an opportunity to get Impact, I got Impact. Then we went to had to go to the emergency room last week and give the information Impact card at the emergency room. There was no problem. But after that visit, I had to see an orthopedic. And so I called the orthopedic office and they said, we'd never heard of Impact. You're not in our network. I said, listen, we're in your network. I said, just do me a favor, ask your billing department to put our payer ID number in the system. And they said, okay, so well, what, do you have a customer service number? I gave them the Impact number. They said, well, we'll contact you later. The following day, they called me up. They said, listen, you can schedule your appointment anytime you'd like to. Because now obviously they had contacted Impact and realized that, who Impact was. So my experience, and this was the first time I've used it because, with the exception of getting, physicals. So my experience, it's been incredible. I've always been an advocate of Impact, but I'm even more so now than I was before. Thank you, Jeff.
Yeah, I appreciate you, Mike. And look, having impact's one thing, using it another. And look, like I mentioned before, that provider pushback can be real for people. You went to the emergency room, everything was fine, just no questions asked. You told me you went in the ambulance, no question asked. Great. Had to go see the orthopedic, had that provider pushback, gave him that payer ID number, gave them the phone number, called Impact. They called you back. Hey, this is great. You have no problem here. When can we see you? But one of the points I really want to bring up, because this is just a real thing for so many Americans, as Mike mentioned in the beginning of the call, Mike was one of the people that was opting out of healthcare previously. Because the cost was so high. Mike being self-employed, didn't want to pay a lot of money. He was like, hey, I'm healthy, I'm fine. But when he heard about Impact, said, you know what? This is something that's affordable. Mike, by the way, how much do you pay per month? What's your Impact monthly standard rate?
288.
So how much agree for an American family, $288 is affordable for healthcare?
Yeah.
I talked to somebody yesterday, their family of four was spending $3,100 a month. How much agree? That's more than some people's mortgage every month. How many agree? That's not affordable for a lot of people. Would read $288, it's affordable. And Mike said, you know what? I'm going to become a member because God forbid if something happens to me, at least I'm going to have a peace of mind. And look, that was a just in case, became a member, and now just somebody that's even more of an advocate for our community. And you can read Mike's full story of what happened to him and everything on our Facebook community. But I just want to thank you, Mike, for, being on. And look, anybody here that's like, hey, I've got a story that I want to share, just reach out to me on Facebook or put it in the quote. We'd love to also every week, we love to highlight at least one member per week and just have them share their real life story with impact. And also, guys, and Mike, was there anything else you wanted to add?
Uh, Listen, no. Well, the other thing I touch on is I did get because that was prior to when I was picked up by the ambulance, they didn't ask for insurance information, but they did send me a bill requesting the insurance information. So once they get the info and then they touch base with the Impact, I'm expecting that discount there as well.
Yeah, love again how Impact reprices those bills for us as members, and you'll have to post that in the Facebook community.